Hello, my name is Misty Ruiz and I'm doing my video on Adderall. Adderall, the study drug, the diet pill, an energizing drug? There is a misconception among teenagers and young adults believing that prescription medications such as Adderall are safe due to being prescribed by a physician and are safer in comparison to street drugs. However, just because Adderall is prescribed by a doctor, it does not mean it is safe, especially if misused. So what is Adderall? Adderall is a stimulant, also a prescription medication made up of amphetamine and dextroamphetamine. There is two forms of Adderall, instant release, IR, and extended release, XR. Adderall is also known as Addies, Beans, Black Beauties, Dexties, Speed, Pep Pills, and Uppers. It is in the form of a tablet or capsule and varies in color from white, yellow, orange, and blue. It is taken orally or it is injected. For a stronger immediate effect, Adderall may be crushed and snorted. Adderall is a central nervous system stimulant and is prescribed to treat attention-deficit hyperactivity disorder, ADHD, and sleep disorder narcolepsy in children, adolescents, and adults. It is mostly used without prescription by college students and high school students, people with eating disorders, and athletes, for the purpose of studying and an academic performance enhancer, also to stay awake longer and focus, as a diet drug and appetite suppressant, an endurance and performance enhancer, to reduce fatigue, and as a party drug. So how does Adderall work? In fact, Adderall does not usually improve cognitive functioning or the ability to learn in individuals who do not legitimately suffer from ADHD. Adderall functions by stimulating the central nervous system. It is less potent than amphetamines, yet more potent than caffeine. According to the American Addiction Centers, Adderall binds to norepinephrine and dopamine receptors in the brain and epinephrine receptors in the adrenal gland. This produces an increase of an unnaturally high level of feel-good chemicals in the brain, resulting in a more focused state of mind and euphoria. The effects of Adderall on the body. Adderall stimulates the brain, causing alertness and productivity in individuals who abuse and overuse this stimulant, who can eventually develop an addiction. Under the Controlled Substance Act, Adderall is classified as a Schedule II controlled substance because of its additive properties. In addition, Adderall effects include headaches, weight loss, body weaknesses, nausea and vomiting, constipation, tremors, seizures, blurred vision, shortness of breath, dry mouth, high blood pressure, loss of appetite, hives, and constricted blood vessels. The risks of Adderall. The risks of using Adderall include blurred vision, fatigue, mood swings, depression, irregular heartbeat, hallucinations, and overdose. Also, withdrawal symptoms, psychomotor retardation, failure to quit and cut down on Adderall use, and develop tolerance or dependence. Since Adderall is a stimulant or gateway drug, commonly Adderall may be used in conjunction with other illicit drugs. Some combinations may include marijuana or alcohol. The consequences of Adderall include physical, emotional, and psychological problems. Prolonged use of Adderall abuse and addiction not only leads to health problems but can also lead to dependence or sudden death. In addition, other consequences of Adderall are psychotic episodes, malnutrition, panic attacks and anxiety, paranoia, sexual dysfunction, suicidal thoughts, a heart attack, tremors, and kidney disease. Also, due to drug dependence, the brain's ability to produce neurotransmitters adequately is disturbed, meaning that they depend on stimulation from Adderall and cannot reach equilibrium. Treatment. Treatment varies from each individual wanting to recover and going through Adderall withdrawal. According to the American Addiction Centers, it is hard to quit the use of Adderall due to the brain damage the drug can cause, so medical detox with therapy can help soothe physical distress and boost the chances of a complete recovery. In addition, recovery consists of medication-assisted treatment, MAT, and psychotherapy. It is recommended that individuals detox first at a facility or via a hospital program, next go through psychotherapy and cognitive behavior therapy, CBT, then join a self-help group or an outpatient program such as a 12-step program aftercare. Thank you for watching.